Space travel has always inspired awe and curiosity, but what happens to the human body when we leave Earth? From the early days of Yuri Gagarin to the International Space Station today, astronauts have faced unique medical challenges. As we prepare for longer missions, like a trip to Mars, understanding the effects of prolonged space travel is critical to ensuring the safety of astronauts. Today, we'll explore what we know so far about how space impacts the human body. In space, the absence of gravity means that the muscles we use to walk, lift, and move become almost unnecessary. Astronauts on the ISS experience rapid muscle atrophy in their legs, lower back, and core. Muscle mass can decline by up to 20% in just 5 to 11 days. One study, using MRI scans of astronauts after returning to Earth, found significant muscle loss in the lower body, with muscle volume in the quadriceps shrinking by 10 to 15% after just 2 weeks in space. To fight muscle loss, astronauts on the ISS engage in daily exercise routines, including resistance training, treadmill running, and cycling. These exercises are designed to mimic the effects of gravity by putting stress on the muscles and bones. But muscles aren't the only part of the body affected by microgravity. Our bones are also at risk. Without the constant force of gravity, bones no longer need to support body weight. As a result, astronauts can lose up to 1 to 2% of bone density per month, a process similar to osteoporosis. Studies conducted on astronauts after long-term space flights revealed that bone loss primarily occurs in weight-bearing bones, such as the hips, spine, and legs. This bone degradation increases the risk of fractures upon returning to Earth. In microgravity, another dramatic change occurs: fluid distribution. On Earth, gravity pulls fluids like blood and water toward the lower body, but in space, fluids redistribute, causing a puffy face and slimmed-down legs. One of the most concerning effects of this fluid shift is its impact on vision. Known as spaceflight-associated neuroocular syndrome, or SANS, this condition affects around 60% of astronauts who spend extended periods in space. Symptoms of SANS include blurry vision, flattened eyeballs, and swelling of the optic nerve. These changes can be permanent in some astronauts, affecting their ability to see clearly, even after returning to Earth. The cardiovascular system also undergoes changes. In the absence of gravity, the heart no longer needs to pump as forcefully. Over time, the heart muscle begins to shrink slightly, which can affect an astronaut's ability to handle gravitational forces upon returning to Earth. This can lead to orthostatic intolerance, a condition where astronauts struggle to stand or walk when back on Earth due to dizziness or fainting caused by poor blood flow to the brain. Space travel isn't just physically demanding, it also weakens the immune system. In microgravity, immune cells become less effective, and astronauts face an increased risk of infections. Studies conducted on astronauts reveal that T cells, which are responsible for fighting infections, become less active in space. NASA researchers found that stress, radiation exposure, and altered sleep cycles all contribute to immune suppression. Interestingly, dormant viruses like the Epstein-Barr virus, which causes mono, can reactivate during spaceflight. This means astronauts have to be extra vigilant about monitoring their health during missions. Isolation in space also plays a role in mental health. Prolonged confinement in small enclosed environments can increase stress levels and even lead to conditions such as depression or anxiety. NASA has developed countermeasures such as routine communication with family-structured schedules and virtual reality environments to simulate Earth-like settings, all aimed at maintaining mental well-being during long missions. Perhaps one of the greatest dangers of space travel is cosmic radiation. Beyond the protective shield of Earth's atmosphere, astronauts are exposed to higher levels of radiation, increasing their risk of cancer, cataracts, and cardiovascular diseases. On Earth, we're shielded from this radiation, but in space, astronauts are bombarded by particles from the sun and cosmic rays. Long-duration missions, such as a journey to Mars, could expose astronauts to radiation levels 100 times higher than what we experience on Earth. Radiation doesn't just increase cancer risk, it can damage cells at the DNA level, leading to degenerative conditions. NASA has been testing materials for spacecraft that can block or reduce radiation, but there is still much work to be done. As space travel advances, scientists are working on solutions to these medical challenges. From advanced shielding to medications that protect against muscle loss, researchers are striving to make long-term space travel safe. With missions to the Moon and Mars on the horizon, the next generation of astronauts will face even greater challenges. But with innovative medical research, we may soon overcome these hurdles and expand human presence beyond Earth. Space may be the final frontier, but it's one filled with both wonder and danger. As we continue to explore the stars, we must ensure that we protect the brave men and women who make it possible. Subscribe to Diagnostic Lens for more space and medical insights.